People would present with different symptoms depending on the site of cardiovascular disease. So let's start with the brain. A stroke can present with sudden numbness, weakness, loss of speech, difficulty in swallowing, even nausea and dizziness. Symptoms of heart attack can be a bit tricky. Diabetes, uncontrolled for a very long time, can damage the nerves to the heart, which cause pain. And sometimes patients can have a heart attack without having any pain, and this is called a silent heart attack. The things to look out for in this particular type of heart attack would be other symptoms such as sudden sweating, dizziness, nausea, and vomiting. And if anybody faces any of these symptoms in diabetes patients, they should go to the hospital right away. However, classically, heart attack will present with severe sudden chest pain that can occur while resting or even exercise, and that can last for more than 5 to 10 minutes, and it is a central, very severe crushing pain. This will be associated with sweating, nausea, vomiting, and dizziness. Patients with diabetes who have had a heart attack can lead to heart failure, which presents with shortness of breath and difficulty in walking because of shortness of breath, as well as dizziness. What is also important to remember that patients with diabetes can develop heart failure even without a heart attack. And that is what both patients and physicians need to look out for. Peripheral arterial disease, or disease of the blood vessels to the lower limbs in particular, which is caused by blocking of these blood vessels, reduces the blood supply to the legs, which can cause pain in the legs while patients are walking. They will feel this pain usually within 15 minutes to 20 minutes of walking, and that is the first symptom that the lower leg blood vessels are being affected. Patients can feel cold in their extremities, get cramps, and numbness in the lower legs. And this could also lead to developing ulcers, which are very difficult to treat and can ultimately lead to amputations. It is important to reiterate and emphasize that symptoms of cardiovascular disease can be silent. It is therefore very important that the patients have their regular checkups with both their diabetologist and cardiologist, and this could include doing repeated ECGs at regular intervals. Cardiovascular disease can be prevented. First of all, we should reduce our carbohydrate intake. That will help us reduce the weight and develop a healthy lifestyle and healthy eating. We need to stop smoking. The blood pressure and blood sugar control has to be achieved. HbA1c, which is the average blood sugar reading, is a key marker, and specific targets have to be met. I would like to emphasize the importance of reducing bad cholesterol. And there are certain targets that have to be met, so please do listen to your doctor, and please do take the medications they have prescribed in the appropriate doses. If you have any concerns or questions with regards to diabetes or heart disease or any diabetes related condition, our doors at ICLDC are always open. Please book an appointment.